I always love the AHA scientific sessions because of the breadth and depth of clinical content and scientific discovery being presented here.
So to me, the most interesting topic this year is the approach to hypertension.
To summarize in a very pithy way, 130/80 is the new 140/90.
And I think we struggle on a daily basis with the management of patients with hypertension, so hopefully these guidelines will help us deliver better care to our patients.
I think a lot of the innovative research at this particular meeting has focused on health services research, and I think that some of these findings are incredibly helpful in terms of managing our patients.
One of the things that I think is very interesting and very important in medicine are approaches to improve personalization of care in cardiovascular therapies.
For someone like me that focuses on the use of biomarker testing in heart failure, there's a late-breaking clinical trial focused on the use of something called metabolomics to better prognosticate the likelihood for the development of coronary artery disease. These kinds of studies really show us where the future is heading.
One of the more exciting presentations was by a young investigator, Lu-Chen Wang, on a project led by Steve LUBITZ here at Massachusetts General Hospital, in which they looked at both the lifetime risk and then the genetic risk of atrial fibrillation.
For me in particular, I really enjoy the Arrhythmia Research Summit and the Precision Medicine Summit. Gives me a good understanding of where the field is and where the field's going over the next few years.
So I think one of the most interesting findings that's really been evolving for many years, but that's really come to fruition this year, is that we're really gleaning a better understanding of overall inflammation and how that contributes to atherosclerotic cardiovascular disease.
What we learned during this meeting is that we can actually use biomarkers to better tailor the use of canakinumab with the hopes of improving the ratio of benefit to risk.
So the most interesting topic at this year's scientific sessions from the sports and exercise cardiology perspective continues to be this issue of whether an individual can get too much exercise, whether something that we know is inherently good for you can be overdone and actually start causing harm. And this continues to be both a scientific and a clinical topic that many of us are wrestling with.
A lot of the people that I've trained with and people that we've trained are in amazing positions doing wonderful things throughout the country. So it's a delight to be here, and it's just wonderful to catch up with many colleagues.